Hi, my name is Marlo Ball, and I am a veterinarian with No Place Like Home. I provide veterinary house calls in the comfort of your own home. I'm coming to you from my own home, from the comfort of my home. This is my cat, River, and I am on here today to talk to you about senior pet care. September is Senior Pet Awareness, and I wanted to take a minute to talk to you about cats. The saying in veterinary medicine that could not be more true is that cats are not small dogs. They have unique diseases that are difficult to pick up. They do not metabolize medications the same way as dogs. And because they tend to hide a lot of their signs of illness, it's often later in the process that we realize that something's wrong. So what are the things that we can do to pick up on signs of illness? And what are the interventions that we can do to help improve their quality of life? One of the most common things that I'll see in older cats is chronic kidney disease. This is something that a very large population of senior cats have, and one of the first symptoms is a decreased they may lose weight, and you'll often see that they will drink more water and urinate more. They may also start to have urinary accidents outside of the litter box. These are cats that you used to never see drinking water, and now they are constantly at the water bowl. It can be more difficult when you've got multiple animals that are sharing the water bowl. If you are seeing weight loss, and increased water drinking or increased urination in your senior cat, it's going to be really important that you have some blood work done to check kidney values. Ideally, we'll get a urine sample and check the urine concentration, as well as look for signs of infection. About 12% of our cats with kidney disease will have some underlying infection in the bladder as well. By recognizing and treating this early, we can make some interventions that will hopefully improve their quality of life and often the length of life. One of the first things that we're going to do is a diet change to a low protein, low phosphorus kidney diet. Another thing that we can do is subcutaneous fluids, and this is where we give fluids under the skin depending on the personality of the cat and my owner's comfort level. This is something that actually owners can be shown how to do at home, or it can be done in a clinic, or we can help you do that service in your home. This can greatly prolong their quality of life, in addition to making diet changes and treating any underlying kidney infection. Another common thing that we'll see in senior cats is hyperthyroidism, and we'll often see weight loss with an increased appetite. They may have changes in their behavior, vocalization, and then they can also have GI signs. Another complication is some heart changes that are related to the condition of hyperthyroidism. It is something that can be diagnosed and treated. There's many ways to treat it. There's surgical interventions. There's referral procedures that involve radioactive iodine to deactivate the enlarged thyroid. And then there's medications. These are all viable options for treatment. The good news is we can manage a lot of these cats and improve their symptoms and their quality of life. Again, it's one of those things that the cats are not really good about showing signs of illness until it's progressed pretty far along. So doing routine senior blood work in your cats that are over the age of 10 can be very valuable so that we can pick this up before we have changes to the heart, changes to other organs. Another thing we have to be aware of is that when we treat that underlying thyroid issue, we may expose an underlying kidney disease that was masked by the thyroid condition. So I will often recheck both a thyroid and a chemistry when we start them on treatment programs. protocols because we don't want to miss something that we can intervene and improve their quality of life. Another difficult thing to pick up in cats is going to be arthritis. Cats are very good at hiding illness, and you won't see them limping the way that you often will with the dog. You will find that they're not jumping up into the window the way they used to. They may not be as active or, you know, chasing you, jumping up on the couch in ways that they used to. I'd say probably the most common way that I see arthritis is that they don't jump up on furniture the way that they used to, and they have decreased activity level. Arthritis in cats is more complicated, in my opinion, to treat than dogs because they do not metabolize anti-inflammatories the way that dogs do, and so we have to be very careful about the pain management that we give. And there's also the challenge of getting medications into a cat. Cats have their own ideas about how they want to do things, and you know, a plan where we've got 13 pills for you to give your cat is going to be a challenge. So we have to take that into consideration. We are going to pick up a thyroid issue by running some blood work. And in addition to checking a thyroid, it's very important that we check kidney function and then recheck that as we start them on medications to make sure that we don't unmask a kidney issue that we didn't know was going on. So what about arthritis in cats? One of my favorite places to start is a joint supplement like Cosequin. I really like the supplements that you can add to canned food. It's a capsule that you can break open and mix in with canned food, and they think they're getting a great treat. And don't tell them that we have medications in the canned food. So joint supplements like Cosequin can be very valuable. I tend to steer away from anti-inflammatories because of the risk of kidney disease. I do have some very painful cats who really require anti-inflammatories, but I don't tend to use them long term, and I use them very cautiously. We need to be really watching to make sure that we don't hurt the kidneys as we're giving medications for arthritis. Another thing that I've seen help a lot of senior older kitties is Adequin, which is an injection that we start giving twice a week for about 4 weeks, and then we taper them down. Unfortunately, it's not a one and done kind of treatment, but for a lot of cats it can really help with their joint pain, and it has fewer side effects than anti-inflammatories in cats. So those are kind of, and then the final thing I'd like to talk about is diabetes. Diabetes in cats can look a lot like kidney disease. You're going to see weight loss and often drinking more, urinating more. They may be having urinary accidents in the house. Diabetes is also something that is manageable. Sometimes just a diet change is all it takes, but most often we need to treat them with insulin. I'm amazed at how great a lot of cats do when it comes to treatment, but again, it depends on the personality of the cat and the comfort level of the owner. Again, this is a disease that is going to be diagnosed by doing blood work and checking the urine. And again, I'm amazed at how well cats can hide it. We also have to be aware that cats that are stressed, for example, you know, during the blood draw, that can cause their blood sugar to spike, and so it can make it a little harder to diagnose diabetes. They can have high glucose just from stress, so we need to see clinical signs of weight loss and increased water consumption. And then we need to see those glucose numbers within a certain range. Again, this is something that can be managed, and we can greatly improve their quality of life and length of life by intervening early. So the bottom line is that cats are not dogs. They do not show signs like dogs. They do not like medications like dogs. They create, you know, their own list of challenges. Many cats do so much better in the comfort of their own home. So if you have a senior cat and you're seeing some signs, I'd love to visit with you about why it's important for us to be looking for some of these things and what we can do. If we could help you in the comfort of your own home, we would love to help you with that. So again, my name is Marlo Ball with No Place Like Home. We are providing in-home veterinary services. We provide annual visits, senior blood work, multimodal pain management, and we also do end-of-life care for in-home euthanasias, and we partner with a great company to provide cremation services as well. So again, Marlo Ball, if you have any issues with your cats or you'd like to talk, I'd love for you to give me a call. It's 501-516-6813. I'd love for you to leave some comments about what has helped your cat and how you knew that your cat was aging and needed some intervention. So again, Marlo Ball with No Place Like Home. Thanks for your time. And again, September is Senior Pet Awareness Month, and I'd love to spend this month educating you about some of the great advancements and how we can improve our quality of life and length of time with our pets. It's an honor to know senior pets. It's an honor to provide veterinary care for senior pets. And I'd love to talk to you more with any questions that you have. Thank you.